Greeting everyone, welcome to Humanity2020 Group Crisis Response Training to assist you in customizing your crisis response for Humanity2020 Group. In crisis come order. In order for you to respond to crisis, we must first be knowledgeable about crisis to identify crisis. Let's define what is crisis and its state of mind. Crisis is a state of feeling, an internal experience of confusion and anxiety to the degree that formerly successful coping mechanisms fail us and ineffective decisions and behaviors take their place. As a result, the person in crisis may feel confused, vulnerable, anxious, afraid, angry, guilty, hopeless, and helpless. Let's get closer with crisis behavior. A behavioral emergency, also called a behavioral crisis or psychiatric emergency, occurs when someone's behavior is so out of control that the person becomes a danger to everyone. The situation is so extreme that the person must be treated promptly to avoid injury to themselves or others. I would to take this time to share examples of a psychological crisis. Some examples of mental health crises include depression, trauma, eating disorders, alcohol or substance abuse, self-injury, and suicidal thoughts. Humanity2020 Group Mission Statement. Our mission is to be a frontline street triage social crisis intervention patrolling and mobilizing team that responds to non-emergency and non-violent for people who are mentally ill, who are intoxicated or disoriented, those who are experiencing a crisis at moment. Here at Humanity2020 Group, we utilize our voice, not force. States CEO of Humanity2020 Group, Mickey Jackson. How can you tell if someone is in crisis? People can experience a mental health crisis due to an extensive span of situations. What might not seem like a mental health crisis to you might be a mental health crisis to someone else. In fact, some people who are struggling may not show any signs of a mental health crisis. I create the following list to assist you in recognizing the signs in adult and youth. Some signs that an adult may be experiencing a mental health crisis include but are not limited to the following: appearing sad or depressed most of the time. Some signs that a child may be experiencing a mental health crisis include but are not limited to the following: rapid mood swings, extreme energy or lack of it, sleeping all the time or being unable to sleep, severe agitation, pacing, talking very rapidly or non-stop, confused thinking or irrational thoughts, isolating themselves from friends and family, not coming out of their room, not eating or eating all the time, rapid weight loss or gain, hopelessness, feeling like there's no way out, anxiety, agitation, sleeplessness, or mood swings, feeling as if there is no reason to live, feeling excessive guilt, shame, or sense of failure, rage or anger, engaging in risky activities without thinking, losing interest in hobbies, work, or school, increasing alcohol or drug misuse, neglecting personal hygiene, withdrawing from family and friends, showing violent behavior like punching a hole in the wall or getting into fights, giving away prized possessions, getting affairs in order, tying up loose ends, or writing a will. These signs require immediate attention. Attempts or threats to harm or kill, verbal or physical abuse, excessive withdrawal, not sleeping or eating for several days, delusions, hallucinations. If the person is in danger, call 911. If the situation is not life-threatening, call the crisis line for the person's county or 988 for the suicide and crisis lifeline. Here is how to navigate the stages of crisis communication. Effective crisis communication strategies are a critical aspect of crisis response, requiring thought and preparation. During a crisis situation, reactive messaging can do more harm than good. When it comes to effective communication, each stage of the crisis needs a slightly different approach. Effective crisis response communication strategies are a critical aspect of crisis response, requiring thought and preparation. During a crisis situation, reactive messaging can do more harm than good. When it comes to effective communication, each stage of the crisis needs a slightly different approach. Now is the time to deploy the team to live crisis. Wherever the live crisis is, using a live communication system is an effective way to ensure you can reach affected communities as fast as possible. A solution that enables you to segment messages by location, function, or other relevant attributes is vital to ensuring the team only receive notifications applicable to them. The last thing we want in a crisis situation where as the crisis responder overlooking calls or messages because of notification fatigue. The response phase can be fluid, so you'll need to communicate your plans with the person in live crisis as they are in self-identity live crisis. Any adjustments or adaptations to your plan should be communicated always. Once the crisis is over, the crisis response team member will assess and evaluate the response and decide what you would do differently in the future. Feedback from our people can also help inform this stage. Any changes to your crisis response management plan or drills as a result of these evaluations should also be communicated to team members. Crisis response communication is Humanity2020 group best practices during a crisis event. It's easy for confusion and misinformation to creep in. But a clear, proactive crisis response communication plan can help minimize this before rumors or hearsay start to take hold and ensure you restate what the person in live crisis is saying for most accurate information. This real-time crisis response communication exchange of information means your person will feel supported and informed as they navigate their way through their self-identified live crisis in addition to providing them with valuable, on-the-ground information. Let's expand further on crisis. What is considered a crisis in mental health? A mental health crisis is any situation in which a person's behavior puts them at risk of hurting themselves or others and/or prevents them from being able to care for themselves or function effectively in the community. What can trigger a crisis? Significant life events, events that most view as happy, such as a marriage, the birth of a child, a job promotion, or retirement, can trigger a crisis in a family, a child enrolling in school, the behaviors of an adolescent, the grown child leaving the home, the onset of menopause, or the death of a loved one can also, just to name a few. What happens to your body in a crisis? These hormones, together with direct actions of autonomic nerves, cause the heart to beat faster, respiration rate to increase, blood vessels in the arms and legs to dilate, digestive process to change and glucose levels, sugar energy in the bloodstream to increase to deal with the emergency. At both the individual and collective levels, stress makes decision-making more irrational, hurried, and unsystematic. It impairs working memory, increases distraction, lowers reaction time, and reduces our ability to process information. That might not even be the half of it, the brain being a truly mysterious thing.
What are the 4 phases of crisis in mental health? With a deeper understanding of the 4 stages of a crisis: 1 pre-crisis, 2 crisis, 3 response, and 4 recovery, you'll be able to identify which stage of a crisis you are in at any moment. A crisis might feel unpredictable, but they all follow a pattern. Pre-crisis is stage 1. This first stage occurs before the crisis itself hits. Some crises can happen at any time, without any prior warning. This is the point that you will notice the first signs of a crisis unfolding. Also known as the acute phase, the second stage, this is the point of no return. You can no longer prevent the crisis from happening. Now your focus needs to turn to crisis assessment and crisis management so that you can rapidly respond and mitigate the crisis impact. This is the most intense phase. The acute stage is generally the shortest of the 4 stages. What to do during the crisis stage: assess, activate, and alert. During this acute phase, your first goal is to assess the situation, with 3 main questions to answer. What is the specific crisis? Who is in crisis? Which response plan should we activate? Once you've identified what the crisis is and who's affected, next you devise Humanity2020 group plan to de-escalate life crisis. How long this stage lasts depends on the type of crisis. Stage 3, chronic phase, response stage. After your response plan has been activated, the crisis moves into its response stage as you extend the resources needed to address the life crisis at hand. Now, you as the mental health crisis responder team member can take action. Now, what to do during the response stage? Take action. By now, you're dealing with the effects of the crisis and attempting to de-escalate. Depending on the type of crisis, Whatever the type of crisis, a swift decision-making from Humanity2020 Group and you as Mental Health Crisis Response Team, you will assist effectively to manage the situation and mitigate additional crises and any risks. During this phase, Stage 4, Resolution Phase, Post-Crisis Stage. At this stage, the crisis can be considered over as you transition our people from life crisis to crisis management back to their baseline as usual. Our people can return to normal life while healing can start to resume. Depending on the type of crisis, this final crisis resolution stage can take days, weeks, or even months. Lastly, what to do during the post-crisis stage, recover. During this crisis phase, Humanity2020 Group will activate our community brief crisis support to assess and treat our people. The recovery phase should also take into account any impact that the crisis may have had on the mental health and well-being of our people. They will need to be taken care of should they need counseling or additional support may be required. This should be discussed. At this stage, the crisis can be considered over as you transition from life crisis to crisis management back to their baseline as usual. Depending on the type of crisis, this final crisis resolution stage can take days, weeks, or even months. At the same time, you will assess your overall response to the crisis. Once you've evaluated the effectiveness of your response, modifications should be built into your crisis response plans and any relevant information passed on to Humanity2020 Group Team Coach, which is our LPC. And now, the four-stage cycle moves back into the first, the pre-crisis stage, as you begin to identify by monitoring and preparing for future crises once more. You can help diffuse potentially violent situations by using the escalation method to prevent potential violence. Individuals are encouraged to use purposeful actions, verbal communications, and body language to calm a potentially dangerous situation. Your safety and the safety of others is the highest priority. Maintain a safe distance and avoid being alone with an individual who is combative or potentially violent. If there is a risk of imminent violence, remove yourself from the situation and seek safety. Know your limits. Keep in mind that some individuals may be more adept in applying these techniques. Know your own vulnerabilities and tendencies and recognize that sometimes the best intervention is knowing when to seek additional help. Obtain help. If you feel the individual or situation is escalating and violence may occur, call for help from Humanity2020 Group security staff and move yourself to a safe location. Check out these tips. Be aware of your nonverbal communications. Ensure your tone, facial expressions, body language, and gestures relay calm and empathy. Remain respectful and courteous. Address the individual with civility and use phrases such as please and thank you. This is a reminder: what are the 3 C's of crisis? The 3 C's of crisis response is calm, cool, and collect serve as the foundation for a robust crisis response strategy. By prioritizing clear and timely communication, efficient coordination, and fostering a collaborative culture, organizations can effectively mitigate the impact of crisis.
During a mental health crisis response, a person is under extreme emotional distress and may be at risk of hurting themselves or others. You may be concerned about a person's mental state or safety. If you find yourself in this situation, take it seriously. A number of circumstances including stress, illness, social problems, life changes, trauma, or violence can trigger a crisis in someone with a mental illness. I would now like to take this time to break down some techniques that may help you to de-escalate life crisis. Keep your voice calm and talk slowly. Listen to the person. Express support and concern. Ask how you can help. Ask if they are thinking about suicide. Encourage the person to seek treatment or contact their health professional. If the situation does not improve, seek guidance from a mental health professional. What is the objective of de-escalation? The main learning objective of crisis is de-escalation is to provide crisis responders with an organized way of making decisions about how they will act in any situation. You ask yourself, how can I de-escalate a situation when someone is angry or agitated? When there are signs of anger or verbal aggression, it is important to remember that you need to stay calm. Anger may be a sign that the person is in distress, experiencing fear or frustrated. It is not possible to reason or problem solve with someone who is enraged. Effective communication skills are the key to settling, resolving, and de-escalating a situation. In addition to de-escalate techniques, you can use these following 7 strategies to de-escalate a crisis situation. 1. Listen to what the issue is and the person's concerns. 2. Offer reflective comments to show that you have heard what their concerns are. 3. Wait until the person has released their frustration and explained how they are feeling. 4. Look and maintain appropriate eye contact to connect with the person. 5. Incline your head slightly to show you are listening and give you a non-threatening posture. 6. Nod to confirm that you are listening and have understood. 7. Express empathy to show you have understood. It is not your job to stop the person being angry, but these steps may help to make the person feel calmer. It is only then that you can look at how to deal with the situation and their concerns. Please continue to Humanity 2020 Group Crisis Response Training Video Part 2. See ya there.